Alright, so here we've got tools to examine the brain, and first we'll start off with imaging techniques. So the one that people most commonly think of is an EEG. An EEG measures the brain's electrical activity and their brain waves, and the device looks like a shower cap. So this is what an EEG readout would look like. For example, symptoms of depression and anxiety correlate with increased activity in the right frontal lobe, brain area associated with behavioral withdrawal and a negative emotion. And with these caps, you can tell where the electrical signal is coming from. Next is a CT scan. CT scan is basically a fancy X-ray. Takes a number of x-rays of the brain, shows tissues of different densities, and allows you to see if there's atrophy, like parts of the brain decaying, or even tumors. So for an example, a child's brain injuries shown in CT scans predict impairments in their intelligence and memory processing, and it looks like this. An MEG, I'm not even going to try to pronounce that, is a head coil, and it records magnetic fields from the brain and its natural electric currents. So it's like this, and it shows a little light up picture of what part of the brain is activated. Soldiers with PTSD, compared to those who do not have PTSD, show stronger magnetic fields in the visual cortex, the occipital lobe back here, when they view trauma-related images. PET, positron emission tomography. This one looks like a heat map. It tracks where a temporarily radioactive form of glucose goes while the brain of a person given it performs a given task. It looks kind of like your CT scan, same idea, but the imaging is different. CT scan is black and white, looks like an X-ray. PET is a heat map. So monkeys with an anxious temperament have brains that use more glucose, they would have more red, in regions related to fear, memory, and reward and punishment. MRI. MRIs also kind of look like an X-ray, although they're a little bit less X-ray-y. So people sit or lie down in a chamber that uses magnetic fields and radio waves to map out the brain structure. So this is actually going to be 3D. People with a history of violence tend to have smaller frontal lobes, especially in regions that aid moral judgment and self-control. And again, looks like a pretty similar doodad there. An fMRI, or a functional MRI, measures blood flow to brain regions by comparing different MRI scans. So this one just shows you like a map. This one shows you where the blood is. Again, looks pretty similar. An example of this, years after surviving a near plane crash, passengers who viewed material related to their trauma showed greater activation in the brain's fear, memory, and visual centers than when they watched footage related to the 9/11 attacks. Okay, those are all imaging techniques. There are other research tools as well. The first is case studies. Case studies allow for the examination of brain injuries and abnormalities. So here's our friend, Mr. Phineas Gage. He's a case study. Also, Junior Seau. He was a Patriots player who was diagnosed with CTE, which is a brain condition where from playing football and having many traumatic injuries to the head, your brain actually shrinks, and you often die pretty young. Split brain research is another one. So in split brain research, you test patients with a severed corpus callosum, that's the thing that connects your two hemispheres, to isolate brain function on each side of the brain. So it's a little confusing. Input from the left field of view is processed by the right hemisphere, and from the right field of view is processed by the left. So here, if the person sees face on their right side, it's going to go to their left brain. And the left brain is dominant for verbal processing, so they can say the word. If they see it on the left side, it goes to the right hemisphere, which is not responsible for verbal processing, but the person can draw it and then look at it and say it. So, a little bit crazy. Another one is lesioning. Lesioning is tissue destruction. Scientists can selectively lesion tiny clusters of neurons to look at how that damage affects function. You can also use like electrodes to not permanently do this to someone, which is probably a little bit more moral. And then, of course, autopsy. Autopsy allows scientists to look more in depth at the brain and at any specific abnormalities. So we looked at this earlier in the year, but this is Aaron Hernandez's autopsy of his brain. There we go.